Yeah, that's a great question. So we hear from our friends in the climate community that extreme weather events are likely to become more frequent in the future as the climate warms. So these are things like heat waves or wildfires or heavy precipitation events. And we know in the public health community that these types of extreme weather events may negatively affect our health. So heat waves are a really good example of this. We've actually known for quite some time that being exposed to high temperatures is bad for our health. And then what I think is less well known, but also really important, is that it turns out people are more likely to die from other types of disease. So for example, cardiovascular disease and respiratory disease when it's hot outside as well. So it's not just about heat stroke, it's also about other types of disease as well. And when you consider all of these types of deaths together, it turns out that heat is actually responsible for a really substantial number of deaths in the United States every year. So to give you a reference point, a recent study looked at heat-related deaths in over 130 cities in the United States that collectively represent about 50% of the US population. And what they found was that heat was responsible for, on average, about 3,600 deaths every year. And again, that's only half of the US population. So this is potentially a really big problem. That's the bad news. The good news is that we may be able to do something about it. So that's what I study. What is it we can do to help people stay healthy when it's hot outside, both now in the present day and also looking to the future as temperatures warm due to climate change? So one strategy we use here in the United States, and that also gets used abroad, is just simply to warn people when it's forecast to be hot outside or when a string of hot days has been forecast. So here in the United States, heat warnings are issued by the National Weather Service, and they usually contain information that you or I can use to protect our health during a heat wave. So for example, wearing light-colored clothing, or drinking plenty of water, or getting to an air-conditioned space if that's a thing that it's possible for you to do. And then on top of that individual level action, they're sometimes also linked to interventions at the community level, at the level of a city or the level of a county. So interventions like that might include things like opening cooling centers or extending the hours of public pools or increasing emergency staffing. So we think that heat warnings are a really important tool for protecting the public's health during heat waves, but we actually don't have a lot of data on whether or not they're effective in reducing deaths and illnesses. And so that's the question that I've been looking at with collaborators here at Brown and also at the Harvard School of Public Health. And we looked at this question, do heat warnings reduce deaths, in 20 US cities between the years 2001 and 2006. What we found is that heat warnings did appear to reduce deaths in Philadelphia between 2001 and 2006. But they didn't appear to reduce deaths in any of the other 19 cities that we studied. And so this is interesting because it suggests that heat warnings, at least during this time period, may have been effective in preventing deaths some places, but not in others. And that suggests a really exciting opportunity, because if heat warnings currently work in some places to reduce mortality, but not others, we can then ask, what lessons can we learn from the cities where they currently do work, and are those lessons transferable to cities where they currently don't, so that we can achieve the benefit of heat warnings for cities everywhere? And that's the work that I'm hoping to do moving forward.